When you begin approaching your 65th birthday, you'll know that you qualify for Medicare simply based on the amount of mail that you'll receive. You'll see stacks and stacks of it. Most of these messages include fear-based marketing, as well as conflicting messages about which plan is going to be best for you. Let's take a moment to talk about when you want to enroll in Medicare. Generally, if you're turning age 65, your initial election period begins 3 months prior to your birth month and extends 3 months past. For example, if you were born April 17th, you'd be able to enroll in Medicare as early as January 1st and as late as July 31st. Let's say you enrolled January 1st. Well, your Medicare benefit will not begin until the first day of your birth month, which in this example is April 1st. Now, just because you can enroll during that initial election period doesn't mean that you should. What do I mean by that? Well, here are a few scenarios in which you might delay your enrollment. Your employer offers a health savings account, also known as a HSA, and also contributes an amount of money to it. Medicare guidelines state that if you enroll in Medicare, you are no longer able to contribute toward your HSA. Let's say that you work and your spouse stays at home. You're both covered by your employer plan. If you elect Medicare and drop your employer plan, well, your spouse will be losing their coverage. So you may elect to take Part A, but withhold on Part B until you're both eligible for Medicare. Then drop your employer's medical plan at that point. Another example may be if you're one of the few lucky people to have an incredibly rich and inexpensive employer medical plan, you'll want to examine the costs and benefits of your employer's health plan and then compare it to Medicare to see if you may be better off financially to go with Medicare. Timing your enrollment in Medicare is extremely important because you don't want to have a gap in coverage, but you also don't want to have a penalty for enrolling late. Yes, you can be penalized for enrolling in Medicare late, but that's a topic for another time. Some of you watching may not even have to worry about enrolling in Medicare because it'll automatically be done for you. There are a few cases in which you would automatically be enrolled into Medicare Parts A and B if you opted to take Social Security benefits before age 65. If you have ALS, you automatically get Parts A and B the month your disability benefits begin. If you have end-stage renal diseases, different rules may apply.